Shashank from Calcutta, and we have Dr. Ajay Kumar from Andhra Pradesh, and wanna be keeping the topic as BPH for today for a better understanding of our viewers. The very first question would be why, according to you, first question from you, why, according to you, are the cases of BPH are on the higher rise these days?
Right.
Yeah.
So one of the causative factors for BPH is the metabolic syndrome. So the incidence of diabetes, hypertension, as well as a poor lifestyle, obesity, mismatched lipid profile, all of this is increasing in the world right now. So this is the reason why the incidence of prostate disease or prostatomegaly or BPH has been increasing thanks to poor food habits as well as to a sedentary lifestyle.
Very correct answer. Well, would be asking you, sir. Why does it become so important for the condition to be diagnosed at a very early age for the patient?
Actually, as sir told, BPH has been on the very high rise because of many metabolic factors and non-metabolic factors, and usually in India we don't have do much of the awareness program. But in the West countries and all, at the age of 50 years, they do get screened for the BPH like serum PSA and all. But usually in India, we don't do those screening programs. But all these early screening programs after 50 years of age will give good incidence of the pickup of the benign prostatic hyperplasia at very early age.
True, true. Well, according to you both, what are the complications that could develop if BPH is not diagnosed at an early age? Can you also share a few instances where you have come across during your practice that may help educating our viewers? Any such instance?
Yeah. So one of the major problems that happens with BPH, in addition to the urinary symptoms, is the high residual volumes. So these can cause changes in the kidneys. This can cause damage to the kidneys because of increased pressure on the kidneys. Sometimes the patient can have recurrent urinary infections. Sometimes they can develop stones in their bladders. And the most dreaded thing is obviously kidney damage, which might be permanent. So it's very important to be aware that your symptoms might be because of a prostate problem in men more than the age of 45-50 years, as my colleague very correctly said, that people should start taking it up to their urologist and discuss it with their urologist. And we have medications available, we have fantastic minimally invasive surgical options available. So once they get their treatment done early on, the risk of the complications will definitely decrease.
Will any instance where the patient comes very late and there was blunders?
Absolutely, I'm sure he'll agree. India is a country where people come when they've already developed obstructive uropathy and the kidneys are already partly damaged because of having very high retention, and sometimes they come at a time when even a prostate surgery might not be a great idea because the damage done to the bladder as well as to the kidney is irreversible.
And they expect the good treatment at that point of time. They expect everything to be normal at that point of time, which is not really, no one can help it out.
Any such instance or any case which you have ever dealt with?
We see a lot of cases. Nowadays we see a lot of cases with they're going into acute renal to chronic renal shutdown because of benign prostatic hyperplasia, because of multiple comorbid conditions like diabetic and hypertensive. So in that conditions, even though you do a surgery, whatever medical line of management, surgical, they have to even accept that they have to live with that the chronic kidney disease problem.
True. Well, Dr. Shashank, I would like to know when the surgical intervention comes into the play, when it is necessary.
Well, there are some classical indications when we operate on a BPH patient. One of the most important ones is refractory low unit tract symptoms. So in spite of medical management, if the patient is still suffering from symptoms, that is one point of time when we operate. Some obvious indications are obstructive uropathy, that is changes in the kidneys, recurrent urinary infections, development of stones, so various complications that can arise due to BPH. Those are times when we have to operate on the patient. And apart from that, it is also a clinician's discussion with the patient. Sometimes the symptoms are very bothersome and we have to offer surgery early on to those patients, even in the absence of complications.
Right. So, Dr. Ajay, would like to know any lifestyle modification that a patient can opt off for the prevention of that sort of problem? Any lifestyle modifications?
Lifestyle modifications, it's a very good topic to discuss on. We do counsel them to have less caffeine intake or decrease in alcohol intake, get their diabetic and hypertension and well controlled. So all these measures really do prevent them or do make not the symptoms worse rather than the prostate symptoms per se. So all these intake of alcohol or caffeine intake and all, they have more on the irritative symptoms. So the symptoms will be much decreased if all these lifestyle modifications have been done. Good exercise, good yoga or something will also decrease the symptoms of the irritative symptoms of benign prostatic hyperplasia.
In addition, what he's pointed is very, very important, and I think more and more people should be talking about this. In addition to this, an active lifestyle and cutting down your animal protein intake. This has also been shown to help with not allowing the prostate to grow too big, especially people who are predisposed to BPH. It has been shown that an increased animal protein intake directly correlates with the increase in size of the prostate. So a reduction in animal protein intake is also advisable, and obviously an active lifestyle which would help to achieve all the things that he mentioned.
Should we avoid the protein, animal protein, or just we can have a balanced diet?
It's more about a balance. A restriction is more than enough.
Yes.
Not really getting rid of it completely, but a moderation.
Controlled.
Yes.
Yes. Thank you so much, sir. Thank you so much,
Thank you.
sir. It was nice having both of you.